Hello, this is a virtual microscopy slide of a case of hemochromatosis of the liver with cirrhosis. At this low magnification view, we can see that the liver parenchyma is very abnormal, and in fact, there are many regenerative nodules of different sizes, replacing the lobular architecture of the liver. In between the nodules, there are these paler areas of fibrosis. So we have regenerative nodules that are separated by fibrous septa. Moving on to higher magnification, we can see that the hepatocytes are still arranged in cords or trabeculae, and there is a brownish discoloration involving many of the hepatocytes. We can also see this brownish discoloration within the fibrous septa. Let's take a closer look at the hepatocytes. Within the individual hepatocytes, we can see this deposition of brownish iron pigment. This is a hepatocyte with the hepatocyte nucleus here and the cytoplasm, and this brown pigment is in the cytoplasm. As we move around, we can also see that there is abundant brown iron pigment within the hepatocytes. In addition, this pigment can also be found within Kupffer cells, which are phagocytic cells that are present within the liver sinusoids. Here is another example of a Kupffer cell containing iron pigment. Let's look at some other areas as well. Here we can see a combination of brownish iron pigment both within the hepatocytes as well as in the Kupffer cells that are present in the sinusoids. This pigment gives the liver this diffuse brownish appearance grossly. Over time, the hepatocytes become damaged and fibrosis can occur, leading eventually to cirrhosis with the formation of these regenerative hepatocytic nodules that are separated by fibrous septa. Over time, the pigment can also be found in the cholangiocytes, which line the small bile ducts. We can see that within this fibrous septum, there are a few small proliferative ductules. In this area, although there is some poor fixation artifact, we can see some bile ductules, and these are lined by cuboidal cells. Within these cuboidal cells, we are able to appreciate this brown iron pigment. Let's learn a bit more about hemochromatosis. Hemochromatosis is a condition in which there is excessive iron absorption and deposition in various organs, for example, the liver, the pancreas, the skin, as well as the heart. And this iron deposition can give rise to damage to these organs. The etiology can be primary, for example, with a hereditary mutation in the genes that are involved in iron metabolism. Hemochromatosis can also be secondary or acquired, and this is usually due to extraneous iron overload. For example, in patients with chronic anemia due to thalassemia or other blood disorders that require repeat blood transfusions. Clinically, the patients may experience hepatomegaly, abdominal discomfort, fatigue, and also potentially diabetes if the pancreas is involved. The skin may also show a darkening or a bronze or gray discoloration. Complications would include cirrhosis in the liver, which we have seen in our virtual microscopy slide, and the risk of cirrhosis is higher in patients with primary or hereditary hemochromatosis. There is also an increased risk of hepatocellular carcinoma. If this condition affects the cardiac tissues, there can be cardiomyopathy as a result. Grossly, the liver is usually enlarged, or it can be cirrhotic, and usually the cut surface will show an abnormal brownish discoloration. And in this picture, we can see this nodular appearance of cirrhosis. And here is an example of hepatocellular carcinoma arising in the background of hemochromatosis with cirrhosis. There is a separate video describing the gross pathological features of hemochromatosis with demonstration of these virtual pathology specimens, and these specimens can be found in Pathweb, which is our free online pathology resource, we have a virtual pathology museum that contains more than 1,000 annotated interactive virtual pathology specimens. You can register for free, and the registration link is in the video description. Microscopically, the hepatocytes will exhibit brownish iron deposits in the cytoplasm, and these deposits can also be seen in the Kupffer cells, which are in the hepatic sinusoids. The iron deposition usually starts in the periportal zone and then moves towards the central zone of the lobules to involve the hepatocytes around the central vein. If this is untreated, over time there can be fibrosis and eventually cirrhosis, which is what we saw in this example. We can actually see the regenerative nodules, which are separated by fibrous septa. And usually Pearl's Prussian blue stain will be positive for these iron deposits within the hepatocytes, Kupffer cells, as well as the cholangiocytes. Here is a medium power view showing the regenerative hepatocytic nodules with the brown pigment within the hepatocytes, as well as the Kupffer cells and the fibrous septa that divide these nodules. In summary, this is an example of hemochromatosis of the liver with cirrhosis, and we can see that the lobular architecture of the liver is disrupted, but instead we have regenerative hepatocytic nodules of different sizes that are separated by fibrous septa. We can appreciate that within the cytoplasm of many of the hepatocytes, this brown iron pigment, and this pigment can also be seen in the Kupffer cells that are present in the hepatic sinusoids, and sometimes also within the cytoplasm of the cholangiocytes that line the bile ducts and ductules, as we can see here, this brownish pigment in the cytoplasm. Patients with hemochromatosis are at risk of not only cirrhosis but also hepatocellular carcinoma. Thank you.